Hello, everybody. Welcome one more time to an episode of the Ibarra Exchange. We're gonna literally talk about TOC. In this case, about OCD, obsessive compulsive disorder. We have Alejandro Ibarra, famous psychologist, clinical psychologist, specializing in OCD and telehealth from Spain, from Seville, and me, Luigi Pesce. I'm a neuroscientist. I work in New York and for a pharmaceutical company. Alejandro, very happy to see you again for another week for the part two of a very emotional, controversial, loaded, but important, interesting, and fundamental topic as it is obsessive compulsive disorder in teenagers, in adolescents, and children.
Hi, Luigi.
How's your week going?
Thank you for having me here in the second time to OCD in teenagers, the topic of today.
Let's follow up the conversation exactly where we left it last week. We were really getting into the topic about the parents, whether they help or not. Based on your experience, when you have parents of a child, of a teenager that is suffering from OCD, that, as we know, the brain in the adolescence can change dramatically and fastly, especially at the cortical level, and they don't have the fully developed prefrontal cortex in order to make the rational, conscious decision and awareness. So it is difficult for parents to have their child, their son, their daughter with an obsessive compulsive disorder that just the name could be a little bit, turn off, even without the mental health stigma or any preconceived notions that they have. But based on your experience, has it been positive overall what parents do during the treatment process? Do they help? Do they not? What is the percentage of those who do?
Yes, definitely. Some of the depends on the family. In my experience, in my practice office, we have some families that help to the OCD sufferer and their recovery, and some other families that doesn't understand what happened with the teenager, what happened with her or his child, and what is the right or how to find the right therapist and the right treatment. So one of our challenge in our practice office, day to day, every day, or every single day, is to spread the awareness in the world, not just in Spain, not just in Seville, not just in Latin America, even in the world, to create more awareness to the OCD and put in the right treatment all the people, in this case, the adolescents and the teenagers. So depends on we work every day to create more awareness and to create that the family understand what happened with the child and to put it on through the right treatment.
When we talk about the understanding of the parent, just to clarify, even the very vast minority of parents that don't necessarily help with the treatment process, it's not voluntarily. It's not like they don't want to help. It's just they don't understand. They're could be even more scared than there's some. When do you think that whenever they're when we boycotting, to sort of speak it, or slowing down the process, or even putting more energy and affecting even like the ERP, do you think are they aware, are they conscious about it? Has there a time where you can maybe talk to them on the side and tell them, I have the best interest for your kid. It's not the end of the world. It's a common disorder. We can fix it. We can go through it. I just need your help.
Yes, once again, depends of the family. Our job and our patient, our work every day is to create more awareness. So depends on the family, because there is a big misconception that is into, and that is through the OCD and through all the mental illness. Or depends of if the person has some symptoms in OCD or GAD or depression. So in OCD, it's very confusing. It's very is not in many times not visible. It's invisible. The ritual are not always motor or physical. The ritual maybe are mental. So it's more difficult to the people, to the community, and to the patient, to the clients, to identify the symptoms. So when we work with families, one of our goal is to make and to put it on all the information, to not create a sabotage into the therapy, to create like a team, to work together and put all the strategies, the skills, and all the right treatment to the unique goal and the main goal to the recovery of him or her. Depends of the client. That is the goal, and that is the point in OCD.
Let's talk a little bit about EPR, about the exposure preventive response treatment that you do. How receptive are the teenagers suffering OCD to the therapy? Based on your experience, based on data, based on the psychologists that work under your practice, how, comparing a teenager with an adult, both suffering from OCD, are there any difference? Is there anything that you see that is different between them? And if not, if it's the same, what do you think that is? How do you think teenagers respond so well to the cognitive behavioral therapy that you do of ERP?
That is a good question, because ERP, exposure and response prevention, is the gold standard treatment to control, to manage all the OCD symptoms. So there is some techniques that are very harmful and that are potentially is not correct to manage the OCD symptoms. So ERP is the main gold standard treatment. So depends of the case, because the mind in the human being is unique. It's just only one. So we have in our experience, in my team and in my practice office, many teenagers that recovery in less time than comparative with an adult. But we have some adults that recovery faster than a teenagers. Why? Depends on the case, because every case is a single world. Depends of the motivation, depends of the compromise, depends of energy to create all the strategies and the skill to do the ERP correctly, frequently, and not just depends of the neurobiological part of the brain, not just, because remember that in OCD depends of many points, many points. But if we center of effort in the behavioral part, we see in our practice office that depends of some points, of many points, and comparative sometimes it is many difficult. We have many teenagers that create a recovery in 6 months, and we have even many adults between 30 and 40 years old that create a recovery in less than 1 year.
Are comparisons healthy? Is it healthy that if a teenager of a parent see this video and says, oh wow, severity, age, maybe a 12-year-old doesn't respond to ERP the same positive way than a 16-year-old, and they tend to very unconscious, very easy to compare. Are comparisons healthy, or people? No,
it's not. Definitely, it's not a good idea, because the teenager can watch the video and say, why him or why her recovering in less time than me? And that is not the main message. The main message is that every case is a big world. So I would recommend always that a client or a sufferer center all the effort in their own recovery, in their own process of recovery. In every single day, do the work, do the ERP, do your homework task, do everything that you have to do to your recovery, and not compare with other sufferers, because it's not a good idea and it's not the best of the ideas.
When you think about teenagers, especially now, you think about people that have a lot of skills. They're They learn fast, they adapt fast, they change their mind fast. There's a lot of plasticity happening in the brain. With all due respect, and I have 5 little siblings that are teenagers too, one thing that is common that teenagers don't have is patience. But one thing that you need for a cognitive behavioral therapy to go through the treatment of OCD is a little bit of patience. Have you seen patients in the will to get better in teenagers suffering from OCD? How patient do they have to be for the ERP treatment? Do you see them as is it difficult for them?
Yes, ERP is hard. ERP is not easy, but it's not impossible. ERP is work, and ERP is wonderful because works, but it's work. The people has to work, the people has to do everything to their recovery. So in teenagers, in adolescents, they are not exception. Anybody or nobody is not exception. The people has to know that recovery is possible to everyone. So it's hard to anyone. So they have to put and getting through the recovery and do all the things that they have to do to their recovery. So I would recommend always center on your effort in your own recovery, because it's not depends of your parents, not depends of your family, not depends of your teachers, for example. Depends on your own responsibility, your own work. So you have to do the work. So I always recommend that work every single day in your recovery. So ERP is wonderful, but you have to work. And you have to work hard. It's like go to the gym. It's like create new muscles in your brain, your mind. It's how to you react with your thoughts, with the world that you are into, with the present, with your future, even with your past. So it's very important to live every day at a time and put your all effort, your energy in your every single day to do everything that you have to do to your recovery.
Like most things in life that are valuable, it could be difficult, but the alternative of having OCD and suffering from the thoughts is way worse. So ERP and the treatment is worth it. And as we said, other 2 important thoughts that we keep going on. Every world is different. Every teenager, every case, every person suffering from OCD is different, not only based on their different genetic and neurobiological composition, but also on their ability to cope with with stress in their environment, which is heavily shaped by their life experiences and realities. Then and another thing is in OCD, because every world is different, every disorder, every symptom could be different. Everybody's trapped within their own maze. And I know we keep going back to that word a lot. We call it in Spanish laberinto. It's maze in English, and it's sort of like an important word that for people to understand what OCD is, especially for those that don't know much or speak at the technical level, because it is sort of like a maze. It is sort of like being on a psychological jail in prison. They're trapped within their own cell. And I want to understand a little bit when teenagers call you or email you or the parents to look for treatment, as so often do after they see the videos, after they find information, after they know your expertise. What are some of the words that they use in order to describe what is happening? Do they use words like maze, jail, prison, lack of control, overwhelming anxiety, disruptive, that help you to figure out and say, this is OCD, this is not, this is mild OCD, but it's tied with something else?
Yes, definitely. When we receive many emails every day and many calls from all the world, from whatever part of the world, Latin America, United States, Spain, or whatever, one of the people are preoccupied that we identify the symptoms. So since around 7 or 8 years, we are doing in PSINCO, Alejandro Ibarra, in our practice office with my team and I, creating big awareness with videos, with every recording some videos, and every week, about twice a week, 2 videos to create more awareness and spread the awareness in the world. So when the teenagers, the adolescents, or the adults, the parents do the call, they are preoccupied, and the most common words are anxiety, misconceptions, diagnosis, mistake in the diagnosis. My psychologist or my doctor, my psychiatric doesn't understand to me. I know that is OCD, but nobody understands me. So the people are very preoccupied and are suffering every single day, and since they are in the morning until at night, 11, 15, 18 hours a day. So when I receive the call, the phone call or the email, they are identified with some videos that you say in your videos about hard OCD, about HOCD, about pedophile OCD or contamination. That is that happened to me. So I want to recover it, because you are the just only one and just the only person that understands to me that what happened with my thoughts, what happened with my mind, what happened with my every behavior or every compulsion that I do. Nobody understands me. Nobody knows that I have. All the psychologists say that I have a GAD, and that is not that I have, or depression or PTSD, and I think that is more difficult than PTSD. I think that I don't have, I don't know what happened to me, but I think that I have many thoughts, and I don't want to have this kind of thoughts. Okay,
and the reason why they receive that information from the previous psychologists or psychiatrists is because they're not, unlike you, they are not specialized in obsessive compulsive disorder. You recognize this condition very well. You are specialized in obsessive compulsive disorder. You understand it, and you understand them when they speak. I just find very, very interesting point that you made, Alejandro. The reason why I asked this question is because it's not like 10, 20 years ago where people called their psychologists, and maybe also thanks to technology. It's not like when people are suffering from psychotic symptoms or from bipolar or depression or from ADHD that they cannot explain in words what is happening. They barely can explain the symptoms. It's really hard to explain a manic episode. It's really hard to explain the lack of will and energy and suicidal thoughts going with a major depressive disorder, or going with some specifics of schizophrenia. It's really even hard to explain for a teenager that is suffering from ADHD or emotional dysregulation disorder. What you are saying is completely the opposite. You're saying that they know that they have OCD. They've seen the information, whether it was Dr. Google, whether they watched your videos, whether they read, and they are clear about it. So it's not so much of wanting to understand their diagnosis, but they want you to be their clinician because they know what they have. They know you're great at it. You know you're one of the best, and they come to you in order to look for help to treat their OCD. Is that what?
Yes, it's very difficult to them. It's very difficult to them to identify the symptoms, and it's very difficult to them to talk about what happened with her or his mind. What happened with my thoughts? What happened if my thoughts said to me that I have to kill somebody, or that I have to? What if I'm gay? What if I don't love my wife or my husband? It's very difficult to understand. So when they call to me, definitely we have part of the solution with ERP, and part of the solution with identify all the symptoms and put it on into the right treatment and the right path of to the recovery. So we were talking about, you and me, the last week, the last episode, about what happened in 1995. We didn't have all the information. We didn't have internet. We didn't have Google, and we didn't have all that happened today, because internet and the sky and Zoom and every thing that is happening today is the present and is the future. So we were talking about what happened to us, or what happened with the people that suffering with OCD in 1995. The answer is that we didn't know, and we didn't have all the answer in that time. And the technology has improved all these equations, has improved all these conditions, and put the main goal is to put it on the right treatment and all the people that suffer with OCD, and create a OCD community into and through the world.
On this final part of the interview, let me ask you two very important questions. One, and we go back to the maze. We're going back to the laberinto, because you mentioned something just now and last week about sexual orientation, pedophilia thoughts, and obsessive with killing or hurting someone or themselves. So just full disclosure, neither sexual orientation or transsexualism are mental disorders. They are not. And a teenager suffering from OCD is not like they're obsessed with their sexuality. They're obsessed to understand what is their sexuality, why maybe, where do they fit in the LGBTQ? So it's sort of like the color of the maze.
Exactly. That is a really good point, because one of the most common subtypes in our practice office in PSINCO Alejandro Ibarra, my team and I, are ROCD, relationship obsessive compulsive disorder, and HOCD, homosexual. What if I'm gay? What if I love, or what if I like the girls of the teenager girls? And it's not a problem that orientation sexual, it's OCD, and OCD is a condition, is a very frequently thoughts about what if. The typical doubt and the typical thoughts with OCD is, what if I'm gay? But I don't want to feel it, but I cannot disappear all the thoughts that are in my mind. That is the point. And we know that it's OCD, because OCD is OCD. OCD is a very, very power condition disorder that has the power in the mind to think something that you are not. So there is a many misconception and many wrong words around OCD. And HOCD is the most common between the teenagers, between 12 years old until 18 years old, but even in the adult. We have many clients in our practice office with HOCD, and they are around or about 40 years old, 50 years old, 30 years old, because OCD is OCD. Doesn't matter what age or how old are you, or what happened with your age. It doesn't matter.
But it makes sense why in teenagers, HOCD, homosexual OCD, again, being obsessed of understanding your sexuality, the whys and the cons, to a point that it creates anxiety. So some people have it with the sink, with the water. Some people have it with counting. I mean, when we talk about disruptive thoughts, it's impossible it's infinite, the amount of thoughts of of subtypes of OCD you can have. Sexual orientation is just one of them. It's just the color of the maze, and it happens to be very common in teenagers, especially because that's the age where they're going through puberty, where they're going through this hormonal change, where the hypothalamus in your brain, it's shooting all these hormones back and forth from the pituitary gland. It makes sense why in teenagers it's much more common, this a homosexual OCD, HOCD, than in adults. My final question to you is, what happens? We talk a lot about the family members, about the parents, about the overwhelmingly amount of parents that do help, that do want to help, and that those that don't, it's not bad intention, it's just they don't understand at the beginning. It takes time. But what about the peers? Adolescence is a stage where, what their peers think of them, that's what they think of themselves. They're very, very influenced by people that are in school, by people they play sports with, their social relations, and even now within the social media. How has been in your practice teenagers dealing with their environments, with their peers? Is it positive? Do they, once they recover, are they able to become some sort of a key or rising opinion leader and sort of like promote, you know, the well-being of teenagers, or they get out of the treatment, they're like, I'm done, I don't wanna know anything about it ever again. How's that process?
Your question is not easy. It's a tricky question because normally the social relationship in teenagers are must or are not healthy when people suffer with OCD, because the silence of the symptoms has to create a non-normally social relationship. That's one part of the problem. And the second one is that the teenagers and the people that suffer with OCD in that age, they are suffering alone. So one of our message is that you are not alone. The people that suffer with OCD is not alone. You are not alone. You are not exception. You can improve your healthy, your quality of life, and you can recover. So we work with many adolescents and many teenagers that suffering alone, but our part of our strategies is to create a community with their families to put it into the right treatment. So after their recovery, many of them, they continue their lives. So they want to hear anything. They don't want to hear noise, or they don't want to hear anything about OCD. And some of them in the United States and here in Spain do many and a good work with peer support, okay, like advocacy. So that is important. We really appreciate when people do that work, because create more community and spread the awareness in all the world. But definitely they are not all the people, okay? So when we have some clients that they can or collaborate or help other people, we are just really appreciate that effort and that point, okay? So depends.
Even those that don't help, they do send messages and texts and saying, thank you so much for the recovery, whether it's anonymous or not, that are useful for people to go to the website of the Ibarra Exchange and see and read that teenagers do recover, that it is difficult, but it's not impossible, that they do make them stronger, and that even though not everyone becomes some sort of a rising opinion leader of an advocate, everybody does a little bit of their share in order to try to help.
Exactly.
I appreciate your time. We'll see you again next week. Thank you so much for talking about OCD in teenagers. We really appreciate what you do. Have a great week, Alejandro.
Thank you, Luigi. Thank you, Luigi. Me too. Bye-bye. Take care. Bye-bye.